So good afternoon, everyone, and welcome to today's seminar. We will learn about the age-related eye disease, inviting Yuka Okada, a registered geriatric nurse at the Momiji Health Care Society. So my name is Umiko, coordinator at Japanese Social Services. So this e-learning session is co-provided by Momiji Health Care Society and Japanese Social Services, and joined by Ihon Center. So before we begin, I have a few housekeeping notes. So this session is recorded, and Q&A and your face or voice will not be recorded. And please refrain from recording or taking photo of this session. And you are muted during the presentation, so please stay muted until the Q&A time comes. And please keep your note for any comments or questions during the presentation. So at the Q&A time, please raise your hand, your comment or question, so you can unmute yourself when your name is called. And we're gonna take a question from chat. So whenever you have a question, you can type your question in the chat, and then we will pick up from there during the Q&A time. And it's up to you to have your video on, but we would be appreciated if you could turn on the video, so it will be more wonderful for guest speakers to interact with you. And if you turn off the video off, and host is gonna indicate when you can unmute yourself during the Q&A time. Okay. And next, we would like to introduce hosting organization of today's seminar. So first, Momiji, Chie-san from Momiji Health Care Society, please go ahead.
Hi everyone, thanks for coming today. My name is Chie. I am a client intervention worker at Momiji Health Care Society. So Momiji is a nonprofit supportive housing in Scarborough. We're serving seniors and caregivers in English and Japanese. And we have a virtual and in-person programs for seniors and caregivers in community and also in Momiji. And we are having an event on June 23rd, Thursday from 1:30 p.m. It's the event about the wellness for the caregivers. So the caregivers are the people who are caregiving to their family members or neighbors or friends, non-paid caregivers. So we're here to celebrate the caregivers' daily caregiving, and so we are focusing on wellness activities such as brain beat dance, or we are getting the singer that's singing the various melodies, and we have a raffle. So it's served by online mainly, but for Momiji seniors, we are having the screening on the screen, projecting on the screen. So our tenants can come and enjoy that event. But if you're caregivers that you want to connect online, please let me know and then we can register for you. And so the contact is here, and we are also having the Tori-ichi Bento fundraising as usual. And as usual, I got mine today. So the next one is a June 25th pickup. So if you can order by June 17 noon, that would be great. Thank you.
Okay, thank you, Chie-san. Okay, so next up, so from Japanese Social Services. So Japanese Social Services is a non-profit agency that provides counseling and programs in both English and Japanese. So we are located in the second floor of Japanese Canadian Cultural Center, but currently providing service remotely. So you can reach us by phone or email. And every month we are hosting e-learning seminar on second and fourth Wednesday like this, and posting details on our website. So please check our website, jss.ca. And also we will be hosting the charity walk this weekend, 12th Sunday. And we'll work or learn together to raise the fund that will go towards JSS operations to support our community members. So please visit our website to register for participating in the event if you're interested, or you can donate through our website. Thank you. So I think that Angela is coming right now.
I don't think she's here.
Angela.
I don't think she's here, so maybe you can read.
Okay. Okay.
Thanks.
So next up is Ehon Center Geriatric Care, and Ehon Center is nonprofit agency.
Wait, she's here. Wait, she's here.
She's here. Okay.
Sorry.
Angela.
Hi, hello.
Hi.
Okay, sorry, Rumiko. Okay.
No problem.
Yeah.
Take away.
I can't find you.
Yeah. Okay.
Oh.
So, hello everyone. My name is Angela, the program coordinator for Caregiver Education Support Services at Ehon Center for Geriatric Care. So Ehon is a nonprofit organization provides community support services, home support services, long-term care homes, and the hospice services in the community. If you would like to inquire about more detailed information, you can call this number 416-412-4570. And we also have educational webinars for family caregivers. And we have a team for community and professional services. You can go to this website for more details. Thanks.
Okay, thank you, Angela. So now let me introduce our guest speaker, Yuka Okada, a registered geriatric nurse at the Momiji Health Care Society. So please, Yuka-san, take away.
はい、皆さんこんにちは。もみじヘルスケアソサイティの看護師の岡田です。まず、皆様、先月ですね、日本語の部のところ、日にちで、予約登録していた方々には大変ご迷惑をおかけしました。個人的な都合で、プレゼンテーションできなくなってしまい、今日来ていただいた方には感謝いたします。で、今日は日本語と英語両方やるので、ちょっとスピードアップしてやっていくことになります。けど、ご了承ください。For I supposed to do the Japanese session in the last month, but somehow I couldn't do it. So today I do in both language. So it's going to be the little quicker, the shorter presentation because I have to combine both language. Okay, so today 日本語からいきましょう。まず今日の、テーマですけども、高齢者によくある目の、問題ですね。病気だけではなくてのコンディションみたいなことも網羅していこうと思います。So I like to talk about the common eye conditions, not only disease, but the conditions that I often see in my daily practice. So I just want to go through all the condition and disease. まずですね、これが失明、日本の眼病の失明ランキングなんですけれども、これは、一番初めに赤いところ、赤いパイ、緑内障と出ていて、糖尿病性、網膜症、そして、よくあるのがその飛び越して緑の、これは、なんだっけな、網膜色素変性を飛び越して加齢性黄斑変性ですね。そして白内障が、一番少なくて 3% の失明率ですね。グラコーマが緑内障が 20% の失明率から白内障が 3% まで表示されてますけども、これは失明率ですね。なので発生率とは違います。This is the pie chart of describing the causes of vision loss. So you see that the most common cause of vision loss is glaucoma, And then you see the diabetic retinopathy, and AMD, the age-related macular degeneration, and the cataract. So please know that this is the cause of the vision loss, but the prevalence, the happening is not on here. Like most common happening among the seniors are cataract, but I will explain later, but this is just the cause of the vision loss. はい、白内障の発生率なんですけども、50代、40代、50代から始まって、80代ではほとんど 100% の人が何らかの症状、白内障の症状を発症していると言われています。So the cataract, that's it starts sometimes 40s in the 50s. But as you see this graph, when you are 80s, almost 100% of the seniors over 80 are showing some kind of the symptoms of the cataract. 白内障は皆さんよくご存知の症状なんです、病気なんですけれども、物がぼやけて見える、霞んで見える、二重三重に見える、光が眩しいとか、あと最近老眼鏡が合わなくなったとか、そういうことも実は白内障の症状であることがあります。こういう症状があるときはファミリードクターかもしくは眼科医の人にかかっていたら名医者さんですねに相談してください。So the cataract is the disease that condition that your lens is become cloudy. The symptoms are blurred vision, and then you can see the double or the triple. Then when you see the light, it's dazzling like a glare. It's too bright to you, and also vision is deteriorating. That you notice that your vision is deteriorating. So if you notice that your reading glasses are not working well for you, that might be the sign of the cataract. So in that case, before you changing the eyeglasses, the reading glasses, better to talk to your family doctor, or if you have an eye doctor, you just discuss with eye doctor. これがですね、典型的な白内障の、視野ですね。正常な見え方と、あと白内障の、これはかなり後期の、ほっといた場合の視野ですけども、もう霞がかかってるみたいに見えるようですね。そして光のも乱反射で眩しく見えるみたいです。で、水晶体の濁りによって起こるんですけれども、原因が悲しいかな、まず加齢ですね、年齢。長年レンズを使っていくと、どうしても曇りが入ってしまうと、そういう単純な理由なんですけれども、それからタバコを吸う方、ハイリスクです。糖尿病、あと目への刺激、特に紫外線なんか一番皆さんが気をつけなきゃいけないことですね。それから生活習慣病とか、あとステロイド剤の副作用でなることもあります。So this is the typical vision of the cataract. The right side one, the left side is no vision, but the cataract. Person with cataract in a very late stage, if you don't do the treatment, your vision gonna be like this, like a very cloudy. You are in a you can't see well. Also, below the traffic light, it's dazzling, it's glare, you can't see well, it's bothering you. That's the sign of the cataract. And the causes are aging. That's the number one cause. Because if you're using any kind of a lens, and if you use 10 years, 30 years, 50 years, 80 years, of course, the lens is going to be cloudy. So that's what the simple reason. The aging is one of the cause. And smoking and diabetes, and then irritation in the eye. Especially for everyone, we have to be careful about the UV rays, ultraviolet from the sunlight. Also the lifestyle, like high blood pressure and obesity. And then sometimes side effects of steroid may cause the cataract. 予防ですけれども、やはりまず一番に紫外線を避けることですね。で、紫外線は適切な質のいいサングラスを外ではかけることが大事だと言われています。それから抗酸化作用のある食べ物ですね。この先3つ、抗酸化作用のあるものとか、生活習慣病の改善、運動、禁煙、このあたりはもうどんな病気にも言われることなんですけれども、とにかくこういう生活習慣改善が一番予防に、どんな病気の予防にもつながると思います。で、抗酸化作用のある食べ物はビタミン A、C、E とかベータカロチンとかオメガ脂肪酸とかよく聞くことなんですけども、特に目にはやっぱりルチンが一番効くみたいなこと、予防ですけれども、ルチンがいいというふうには言われていますね。そして、一番最後のブルーライトに関しては、最近よくブルーライトっていうのは携帯電話とか、コンピューターの画面とかそういうものからブルーライトが出ていって目に悪いんじゃないかと言われていますけれども、実はまだ確定的な研究がなされてなくて、決定的なには眼科医の人たちはこれが決定事項だとはまだ言い切れてないみたいです。ただこれが睡眠に影響するのは確定みたいですけども、白内障とか緑内障とかそういうのに関係するかどうかはまだ研究の途中だそうです。Okay. The prevention of the cataract, of course, the proper eye protection, like of course the good sunglasses when you go under the sun. And I mentioned about the take antioxidant food and the exercise and the no smoking. Those things are very general prevention for any disease, anything. So it's very commonly you hear about that. So exercise, you improve the circulation of the blood, and then vitamin A, C, E, beta carotene, omega fatty acid is very commonly here for improving your health. But for the eye conditions, people say, scientists say that the lutein here, lutein is good. Lutein is a good supplement for prevention of the eye disease. And about the blue light, people nowadays say the blue light. If you know that the blue light is coming from your cell phone and tabloid computers, computer monitors, and people say the blue light might damage your eye, but there's no definite conclusion among the scientists. So we don't know yet. There's for sure that the blue light interfere your sleeping. That's been concluded, but for the effects to the eye disease is not yet concluded. Just for your information. でですね、まず白内障で手術が必要と言われたらということなんですけども、80を過ぎたら大抵の人が症状が出てきて、で手術となるときなんですけども、手術の決めるタイミングは日常生活に不自由を感じたときです。あとお医者さんとよく相談して決めますね。で手術の手順はざっくりこんな感じで手術前検査があって、であと目の中の各サイズ部分のサイズを測定するんですね。そして要するに目の中のレンズを入れ替える手術なので、曇ってしまった自分の自前のレンズを取って別の既製のレンズを入れる、簡単に言うとそういう手術なので、レンズのサイズとか種類も松竹梅あります。 なので、それを選ぶことも、後でまたお見せしますけど、それをしますね。そして、まず目薬をはじめ、飲んでる薬、例えば血液凝固剤、高血液凝固剤かな、を飲んでる人は止めたりして、そういう薬の調節をして、手術は日帰りになります。オンタリオ、おそらくカナダは全部日帰り。一つの目でだいたい30分から45分ぐらいで終わりますので、日帰りで24時間以内に眼科医の検診があり、目薬を使い続け、そして最後に両方の目が白内障ある人は両方の目の手術が終わってから眼鏡を作り変える必要性が大抵出てくるので、それを見てもらいます。Okay, the cataract surgery, when to have the surgery? Actually, when you feel discomfort or inconvenient with your vision in a daily life, that's the timing. And with the consultation with the doctor, that's the time to have a surgery. So those are the steps of the cataract surgery. So of course, the preoperative examination like blood tests, etc. happens. And then doctor will measure each part of the eye, inside of the eye. And the cataract surgery is simply, you said that your own lens is going to be removed and then your artificial lens will gonna be replaced. So you're going to pick and choose your lens, like when you choose the eyeglasses. There's a OHIP covered one to the very expensive one. So you choose it. And then you're gonna start the eye drops and adjusting the medication like a blood thinner. And the surgery itself is about 30 to 45 minutes per eye. Then you're gonna see the doctor within the 24 hours. And then you have to continue the eye drops. It's gonna be tedious because you have to use 3, 4, 5 times a day, but you have to continue, you must continue. And then you have to eventually replace the eyeglasses. But if you have a cataract in both eyes, I suggest that all of both surgeries done, then you're gonna replace the eyeglasses. これが簡単なレンズの紹介なんですけども、まず大きく分けて単焦点レンズですねと多焦点レンズがあります。で、これもスタンダードは全部OHIPでカバーできたりとか、だんだん高くなっていって、例えば多焦点レンズの後でどんな風に見えるかお見せしますけども、一番なんかいろんなファンシーな機能が入ってるやつは自前で、まあ、きっとこれ$2000今の時代、これ何年か前に作ったので$2000ぐらいはすると思います。そんな感じでいろんな機能があってチョイスがあります。Okay, so lens options. So 2 groups. One is monofocal lenses. The focus in the one spot, near or the far, and also multifocal. And as you see, under the monofocal lenses, the one is called standard that covered by OHIP, so you don't need to pay. But when you go down there, like a Symphony, for instance, that is the one that all other features are in there. And then probably you have to pay more than $2,000 nowadays. So I believe that the doctor or the staff working in the eye doctor should explain to you everything, and you can pick and choose. これがですね、カタラクトの白内障の手術をした後に入れたレンズの違いによってどのように見えるかの違いなんですけども、左側の単焦点レンズですね。で、近くに焦点が合うのを選んだときにはこんな感じで見えます。手前これ携帯を見てるんですけど、遠くの電車はやっぱぼやけて見える。こういうレンズを使った場合には、今度は逆に遠くを見るとき用の補正用の メガネが必要ですね。で、逆に遠くに焦点を当て、よく運転をする人とか、ゴルフをよくする人とかは、自分は遠くに焦点を当てたレンズが欲しいっていう人は、遠くに焦点を当てます。そういうレンズを入れますね。そうすると近くがぼやけて見えるので、今度は近くを見る用の携帯電話とか読書するとき用のメガネを作ることになります。そうやって調節ができるんですね。で、右側の多焦点眼内レンズは両方も合うんですけども、これがまた人によって合う合わないとかがあって、完璧にやっぱり自前の目のように完璧に合うわけにはいかないことが多いですね。うまくいく人もいるんですけども、その時はそれを補助する用のメガネを処方されることもあります。Okay, this is the vision, depending on the lens that you choose. So the left one, it is the focused near side. It is good with reading, like sewing, cooking, but you cannot, that lens is focused on to the near side. So you need the glasses that for the far side. If you, just in case if you do the driving or the golfing, you need to wear the far side glasses. And the other hand, the right hand side under the monofocal lens, that is the focused far side. So if you choose this lens, it's good, you're good to go for driving or golfing or the movies theater, I don't know. That's the good for far side, but you cannot see the near side. In that case, you need a prescription glasses for the near side. That's how it works. If you choose the monofocal lenses, theoretically, you are supposed to be, you should be able to see both near and far. But this is the good example, but it's depending on the individual. It won't be perfect. So you may still need to make the eyeglasses to adjust for your weak sight. If your lenses are not clear for the far sight, and then the optometrist can adjust to your weak spot. That's how it works. これは手術なんですけど、これはちょっと飛ばしますね。要するに一番下の方に見えている、これが中に入れるレンズです。こう触手が伸びてみたいな手が入って固定するんですけども、これがレンズですね。Yeah, this is a process of the surgery, and this is the lens that the doctor gonna replace. Yeah, this is exactly what it look like. So that's all of, はい、以上が白内障で、次ちょっと緑内障に行きますね。緑内障は、視神経が障害されて視野が狭くなる病気で、眼圧の上昇が原因の一つです。これはですね、一回かかると何しても手術でも何でも治ることはないです。ただ、症状の悪化を遅らせるということが、治療の、メインの治療になりますね。いろんな種類の緑内障があるんですけれども、原発性偶角緑内障っていうのがあって、これは急性を伴って目が痛かったりとか、急に目がチカチカする、目が痛い、頭が痛い、見えなくなる。こういう時には急性と思って我慢しないで、エマージェンシーに行ってください。失明の危険があります。Okay, so we're going to move on to the glaucoma. That is the eye disease that the optic nerve, the nerve inside of your eye is going to be damaged for whatever the reasons, usually the pressure. Yeah, there are a few types of glaucoma, but I just want to focus that the narrow angle, or another word, acute glaucoma, that's a medical emergency. So you're gonna have a intensive eye pain, red eye, and suddenly the blurry vision happens and a headache. that if that happens, you want to think you may be having the acute glaucoma or the stroke. So this is the medical emergency. You should go to the emergency hospital. 緑内障の視野障害の進行なんですけれども、見てわかる通り、初期、中期、末期ですね。これでどのぐらいのスピードで移行していくかは人によります。で、どれぐらい真面目に目薬をするかとか、どれぐらいちゃんと真面目にお医者さんにかかるかとかによりますね。これは視神経のダメージで起こるので、一回見えなくなると、これが元に戻ることは、残念ながら今の技術では、医療ではありません。一回見えなくなったらもう見えません。で、大抵ですね、初期、中期で気がつかない人がいるんですね。っていうのは、両目見えてる人は、どっちかの目が見えない部分をカバーしているので、意外に気がつかないんですね。なので、本当にもう中期から末期にかけてやっと発見されるみたいなことがあります。だから名車にちゃんとかかるのが大事だということですね。Okay, this is the vision, the progression of the vision loss in the glaucoma, the person with a glaucoma. Often the one eye covers the other eye's blind spot, so the person doesn't notice his or her vision loss until in the late stage. So once you lost the vision, like late stage, it won't be reversible. So it's very important to see the eye doctor annually. 緑内障は早期発見、早期治療、これにかかりもしかないですね。で、目薬なんですけども、これ、しみるし、毎日やらなきゃいけないし、打っても全然、目薬を打っても全然何の変化もないように思うので、どうしても真面目に打たない人が多いらしいんですね。眼科医の先生が言うには。でも、処方された目薬を正しく毎日地道に使うことが、さっきの初期から後期に行くのを遅らせる。重要な手がかりです。重要なことです。だから、目薬は真面目に使いましょう。Okay, so glaucoma, so early detection and early treatment is the most important thing. So, especially the eye drops. The eye doctor said that many patients are not using the eye drop properly. Because you don't feel any improvement with eye drops. But if you stop using the eye drops, the speed of the losing vision becomes faster. So it is very, very important to keep using the eye drops. はい。次に加齢黄斑変性 AMD ってよくショートフォームで言いますけども、これも実はあまり気持ちのいい目のコンディションではなくて、これも一回目の奥の部分に異常をきたすと、もう失明の原因になります。はい。これも急激にウェットタイプっていうんですけども、滲出型というか、急激な視力低下を伴って、これになると、なかなか止めにくいですね、進行が。で、治療は定期的に目の中に、白目のところから注射をするんです。で、薬剤を注射するんですね。3ヶ月にだいたい1回ぐらいの割で治療を受けていらっしゃる方が多いです。で、ドライ萎縮型っていうのもあるんですけれども、これもやはり最終的には視力を失うので、やっぱりちゃんと眼科医にかかることが大事ですね。Okay, so AMD, I hope you have, I wonder if you have heard about the AMD. It's age-related macular degeneration. in my practice, quite a few people has AMD. So it's an eye disease that can can damage your central vision. And its aging is a major cause. And you're gonna become blind. So there are two types, wet type and then dry types. And the wet type, it's a rapid decrease in the vision. So the treatment is you're gonna have an injection in your eyeball, and usually it's every 3 months. That's the treatment. Dry type is the slower progression, but still it may become the wet type. So discussing and seeing the eye doctor, ophthalmologist is important. AMD 加齢黄斑変性、原因はやっぱりこれも加齢なんですよね。それから白内障と同じで、喫煙、太陽光、あと血圧、肥満、高脂肪食みたいなことが原因だと言われています。後でまたどういうふうに見えるのかもお見せしますね。Okay, so AMD, the cause is similar to the cataract. It's aging, unfortunately, and smoking and sunlight and the lifestyle-related conditions. And I will show how you see the person with AMD, how the vision gonna deteriorate. Okay. AMSLA chart, which is like this, and then the person with the AMD, ごめんなさいね、日本語また次に喋ります。person with AMD, we will see like this, like a distort, or that you lose the vision. これが加齢性黄斑性チェックの、加齢黄斑変性の人がアムスラーチャートというものを使って調べるとこういうふうに見えるということなんですね。で、この次にこれでお見せしますけども、こんな感じでこう物が歪んで見えるんです。この線路で行くと正常な見え方が一番左で、初期症状だとこう線路がまっすぐなはずなのに歪んで見えたりとか、そしてもうちょっと進行すると今度は中心が見えないっていうのが加齢黄斑変性の特徴です。でやっぱり予防はサングラスをかけるとか、さっきの白内障と同じでビタミン剤を取るとか、これ用の目の栄養を良くするようなビタミン剤も薬屋さんに行くとその目のセクションのところに売ってたりします。普通のビタミン剤のところではなくて。Okay. This is the vision with the person with AMD. So the normal vision for the line should be straight, right? But early stage it's distorted, not straight. And the middle to late stage, for this disease, you lose the central vision first. That's the feature of the AMD. So go back to the AMSLA chart. If you can try with one eye like this, and then about 30 minutes away from the monitor, and if you cover one eye, and then you can see how, try how you see this AMSLA chart, like this and this. I don't know. If you see like this, don't scare, but you better to go to see a doctor. You better to go to discuss with family doctor first. That works. But that's how you check. Yeah. はい、ここからは病気ではなくて、ちょっとよく加齢に伴ってよくある目の状態を説明しますね。で、結膜下出血っていうんですけども、ちょっとこれよく たまにこういうふうに白目のところがこう赤くなって出血して、皆さんびっくりして私のところに来るんですけれども、もしこれが結膜下出血であれば全然問題ない。心配ないということです。また後で説明しますけども、For the elderly, I often see the person with this subconjunctival hemorrhage. But it is scary because your eye is supposed to be white. The white part is white, but it's bloody, so you're scared. So often people run into my office and then, scared. But if the condition is subconjunctival hemorrhage, you don't need to worry. Okay, for the next slide is going to be the severe type. If you are not good at seeing the shocking image, close your eyes. I will cue you, so close your eyes. 次に結膜下出血のもっとひどい状態をお見せします。ただこれものすごく気持ち悪いので、気持ち悪いのを見るの、映画とかテレビで気持ち悪いのを見るのが苦手だという方は目つぶっててください。今から1、2、3で言いますので目つぶってくださいね。OK。OK。いきますよ。1、2、3。1、2、3。Close your eyes if you don't want to see. そう、これが一番ひどい状態の結膜下出血です。目の周りが真っ赤で、これまではなんかホラー映画みたいですよね。でも大丈夫なんです。これが一番悪い状態だけど、でもこれでもそんなに心配する必要ないです。Yeah, this is a severe case of the subconjunctival hemorrhage. It's like the horror movie, but you don't need to worry actually. はい、目つぶってた方目開けていいですよ。You can open your eyes. Yeah, so結膜下出血何かというと、結膜って白いところの小さな血管が破れて出血したものなんですね。で、原因が力んだ、重いものを持ったとか、便秘で力んだとか、強いくしゃみ、咳、お酒を飲みすぎるとか、実は10日から2週間ぐらいで自然に治るんです、これは。でも、ただし、視力に異常があるとか、痛みやかゆみがある。あとは、これが顔面なんか転んだ後にとか、なんか打った後に起こったとか、一緒に熱が出てる。もしくはこれがしょっちゅう起こる。もしくはあなたが高血液凝固薬を使用している。っていう時にはお医者さんに行ってください。それ以外だと、もちろんね、気持ち悪いからお医者さんに行くのもいいんですけれども、もちろん。でも、心配を、パニックになる必要はないと。それが言いたかったわけです。Okay, so subconjunctival hemorrhage, it's common in the elderly. That small vessel in your eye just ruptured and had a bleeding, like a bruise on your skin. When you bang and you have a bruise. So the causes is strained. When you are constipated, you push or you carry the heavy stuff or the strong sneezing and cough or the too much alcohol. Those are the common causes of the hemorrhage. And usually it will heal naturally in 10 to 14 days. However, here, under the caution, if you have abnormal eyesight or pain or itchy, or the happening after the injury, like you hit your face, you fell, then it happened, or you have a fever, or you have this condition too often, or you're taking a blood thinner, including aspirin, okay? Then you should consult with your family doctor, or even you can go to the doctor if you are having the pain or the vision, abnormal vision. Okay. はい。で、次によくあるのが非分症なんですけども、要するに英語で言うフローターって言って、ここの絵にあるように、今日みたいな天気がいい日にふっと空を見ていると、なんか黒いものが飛んでると。そういうことがありませんか。で、突然起こるとすごい心配して、自分目が見えなくなるんじゃないかと思って、これも心配してくる人いるんですけども、2つあって、要するに生理的な原因、良性でね、加齢とか、主に加齢なんですけども、で起こるときとは、 大丈夫なんです。でも、網膜剥離とか病的な状態で起こる時があります。だから、視力に異常が出てきたりとか、数が増え続けるとか、という時にはすぐにお医者さんにかかってください。So the floaters, there are two types. The one is benign. Again, I'm sorry to say, but it's age related. And also another type is some disease caused floater, like detached retina. This is the serious condition. So if you suddenly you started to see the floating object, but abnormal vision involved, then it constantly increasing the floaters, then go to see a doctor immediately. 私もあるんですけども、ふっと気がつくと、初め出てきた時にはすごく気になったんですけども、放っておくとそのうち気にならなくなる。でも、ビーチとか行って、ふっと外を見ると、空を見るとまた出てきたりして、なんか、そんな感じで、次第に気にならなくはなります。So I have one floater here. When it happened, it was really bothering me. But doctor said this is the benign. So I'm let it go. So eventually it's still there, but I don't notice that in the daily life. Once in a while, when I go to the beach and then when I see the sky, then yeah, I see the floater, but you have to live with it. はい、これ最後なんですけど、ドライアイですね。これも皆さん気がつかないうちによくあるんです。目が疲れやすかったり、痒かったり、痛い、目やに充血、重たい。で、意外に涙が出てきたりするんですね。ドライアイで。ドライなのになんで涙が出るのかっていうことなんですけども、涙が出るんです。刺激が。ドライアイの、いっぱいこすって、ルブリカントがなくてこすって、こうなんか神経的な刺激で出るとか書いてありましたね。で、原因は長時間画面を見続けることですね。テレビやパソコン、携帯から空気の乾燥、夏の間のエアコンも注意です。あと、コンタクトレンズを使っている方、次に書いてあるの、また読まなきゃいけない。加齢ですね。それから薬の副作用。で、これは簡単に治せますよね。ティアドロップを使うと良くなるので、なんだろう、いつも目が調子がゴロゴロすぐ目がおかしい、見えにくいっていうのをほっとかないで、まず目薬を薬局で買える棚に売ってるドライアイ用っていうかアーティフィシャルティアですよね。ドライアイ用の目薬を定期的に使うことをお勧めします。あと、意識的に瞬きをするとか、あまり画面を集中的に見ないとか、あと、よく水分を取ることも大事ですね。そうやって防ぐと日常の不快感が和らぎます。意外に皆さんこれを無視しそうする傾向にあるので、ここに取り上げました。So, dry eye it's really common among the seniors. And itchy, stinging, the burning sensations, and sensitive to light, redness, blurred vision, actually watery eyes as well. You tend to ignore this. You're gonna keep complaining, but you don't think why it's happening. And then, yeah, and then you can try teardrop to see if this condition gonna be resolved or not. So I see many seniors that are living with dry eye but not treating. But think about it, and they use the eye drop. So of course the causes is staring at the monitor longer time, like TV or the computer, and also the having a dry air blowing onto your face. Like in an air condition in the summertime is tricky things, but you have to be careful. when you are wearing the contact lenses. And then, when you age, you tend to become dry for all over. So that's one of the reasons. And sometimes it's a side effect of the medications that you are using. So the treatment, the blink consciously, or the, use the teardrop constantly. That's the solutions. Yeah, so sorry, I have to go really quick, but those are the today's presentation. And I believe that I can send the GA-san the PowerPoint later. So if you want, you can get it from GA. 後でこれのパワーポイントをお手元に届くようにしますので、ご希望の方は高野さんかルミコさんに言ってください。はい、以上です。